We're going to demonstrate electronic and the manual methods for blood pressure. It will be checked off a manual because electronic is just a button and we call it a day. Anybody can click a button. And then be thankful you actually have working vital signs machines. Okay. So let me show you the easy peasy one. When you're doing your blood pressure, the first thing you want to do is make sure with regards to the cuff that you have the right cuff size for the patient. Why? Thank you. Okay, I owe you a sticker. Okay? Very good. Alright? What you're going to do with this machine, you simply turn it on. Voila. Now, when changing the cuff, because this is too big for her arm, simply remove, click the two sides together, click it again, and then let go. That's it. Now, with the electronic, I'm going to put it on her arm. A lot of the cuffs, they do have markings for the artery. And which artery am I going to be using? Brachial. Okay, where's the brachial again? Make sure y'all know your pulses. Don't give me headache. Okay? Alright. Put it just about. You don't want it too loose or too tight. And another method, you can actually ask the patient to extend their arm out, and that actually helps with you putting the cuff on. Does that make sense? Alright. Make sure it's right. And then forward. All you press is these two buttons. And now it's going to read before I start. What should I ask the patient to do? Before, uncross the legs. Okay. Anything else? Relax. Okay. And typically, most time yes.
Shouldn't you ask the patient, depending on where they're coming in at, if they have a pork or pig line?
Oh, well, look at you getting ahead of the game. I'm just trying to show the skill.
That's like fourth semester kind of thing.
Okay, yeah. Why? Since you opened that can of worms.
Because you can't take blood pressure on the side of the line in place.
Yes, why not?
Because it can cause a clot or damage to the line.
Good job. I worked in BMT for a long time.
Oh, what is BMT? I don't know what
Bone
that is.
marrow transplant unit.
Oh, nice. Look at you. Okay. All right. Now, of course, you want the patient to relax. Yes, like Serena or Rebecca.
Close.
Okay. Yes. All right. You want the patient to relax, and also sometimes I ask my patient to put their palms up. Okay. And then take the blood pressure, and then that's it. Now we're going to do the manual one. The manual one is a bit more complicated. And guys, I know I didn't say this, but before you do anything with the patient, what should you ask? Okay, yes, name and date of birth. What else should you be asking the patient before you do anything? Consent. You need permission. Ask for permission to do anything with the patient because they may not want you touching them.
Yeah, and also explain to them what you're doing, right?
Yes.
Introduce yourself. Hi, my name is Christine. I'll be your nurse. I'll just keep taking your vitals. Is that okay?
All right.
But sometimes people just go in and start messing around, and then they're like, "Wait, what are you doing?" And then
yes.
they're gonna go to the manager and complain.
They will. The skills checklist goes very intense for the manual. I'm gonna come here. What should I do first? Remind me for the manual blood pressure. For those of you who did do what you're supposed to do. Huh? And then
put you can put the cuff on. Pump it to see where the systolic blood pressure drops, and then add 30 to the pump.
she read out. Okay, I'm already in debt. Look at that. Okay, so I'm gonna palpate. Okay, in the interest of time, just pretend I palpated and I noticed that her brachial pulse is right here. Okay, so this is where I'm gonna put the cuff in the area where I palpated it. Now this is optional if you want to attach it or you want to hold it. It's easier for me to hold it. I heard it at 120, let go. And I'm supposed to let her arm rest for at least a minute because I have cut off circulation. Please remember to release once you hear the systolic and also once you get your reading. Okay, because you are compromising circulation. All right, so I had it at 120. Now that I'm ready and she's relaxed, I put it at what? I inflate to what number now? 150. Okay, I'm going to inflate to 150 and then I'm going to listen for her reading. Okay, you guys, actually I'm ready to put this in my ear. I inflate to 150 and listen. And when the thing is, you want to get into the habit of being able to maneuver this little dial, okay, if you want. All right, I'm listening for it, and I'm gonna let it go slowly until I hear the first thump. I hear the first thump at 118, and I let it go a little bit slower again. Well, not slower, but faster, but not too fast. And then I no longer heard the thump at 62. What's her blood pressure reading?
118/62.
That's all you are telling your clinical instructor. Okay? During practice, you can ask any question you want. During checkup, nothing. Okay? Now, we will be using a dual head stethoscope while doing that. Any questions on blood pressure? Manual. Good.